Hello, everyone, and welcome to our session for today. I hope that all of you are managing very, very well. My name is Dr. Sahar Ali, the founder of PLAB 2 Warriors Groups. I work in the NHS in acute medicine. I am a simulation faculty for the junior doctors in my trust. I am also a PLAB 2 instructor for more than 4 years now. Through this period, I helped hundreds of doctors to pass, alhamdulillah, through the services that I provide, which are the full course, the practical course, and the one-to-one mocks. Recently, I resumed the free mocks in a renovated format. This will be in the form of teaching sessions on a specific topic. These teaching sessions will be added to a new series of videos named Teaching Gems. After each teaching session, there will be a mock session on the topic discussed. This will help consolidating your knowledge and technique in that particular topic. Hopefully, you will find them super helpful and beneficial. Anyone wants to know more about my courses, please stay at the end if you don't mind. Let's get started. This is our structure for today. The teaching session will be about breaking bad news. Breaking bad news is one of the challenging cases in the exam and in your life as a doctor as well. So hopefully you will be able to deal with any bad news either in the exam or in your life as a doctor after attending this session. All right. In this session, we are going to emphasize on 3 main points. How to recognize that this case is a breaking bad news case, how to deal with any breaking bad news case, even if it's new, what are the essentials that you need to have during breaking the bad news. All right? Let's start by the first one, recognition. How to recognize that the case that you read is a breaking bad news. For that, we are going to take some examples, and I need your interactivity, doctors. All right? When I ask something, please write in the chat box or just open your mic and talk. All right? Let's take the first example. A 40-year-old patient came with severe headache. They have done CT scan on the head, and the CT scan showed massive bleeding in the brain. Massive bleeding in the brain. The multidisciplinary team put the patient on the palliative care. All right? When you talk to the relatives, either the son, the daughter, or the wife, and you ask them, how much do you know about the case? Remember, doctors, this is one of the smartest questions when you talk to a relative. How much do they know about the condition of the patient? Why? We are going to talk about why in a while. Once you ask this question, they tell you, we know that he had severe headache and the CT scan has been done, but we don't know anything about the results yet. Do you think delivering the situation is a bad news, or this approach will be a breaking bad news or not? Is this breaking bad news or not? Let me check the chat. Yes, it is breaking bad news because the relatives don't know anything about the updates. They don't know anything about the result of the CT. All right? Okay. So this is breaking bad news. We have recognized that this case is a breaking bad news. All right. The next example. The next example is the same question. 40 years old with severe headache. CT scan has been done showing massive intracranial bleeding or brain bleeding. The patient on the palliative care. When you ask the relatives, how much do you know about the case? They tell you, we know that my dad or my husband or whatever had severe headache. They have done CT scan. CT scan showed massive bleeding in the brain, and they put him on palliative care. They know everything. All right? Will the approach be breaking bad news? No. Good. Good. All right? They know everything about the bad news. They know everything about the updates. So this is not a breaking bad news. And that's why I told you one of the smartest question is asking how much does the relative know about the patient's condition. All right? Let's take another example. A 35 years old lady came with a breast lump. They have referred her to the breast clinic to do fine needle aspiration cytology, and the result is ductal carcinoma in situ. Okay, the patient has an idea that one of the causes of this breast lump is cancer. She has an idea that one of the causes might be cancer. Will this be a breaking bad news or not? Yes, that's good. Why? Why it is breaking bad news? She was not sure. Yeah? Yes. Good. There is some probability it might not be cancer. Right. So it is still breaking bad news, but you are going to break it in maybe 1 or 2 shots. And we are going to talk about how to break the bad news in shots, pieces and chunks. All right? But this case is still breaking bad news. All right? The last example. A 25 years old man came with chronic pain in the right knee. They have done X-ray. The X-ray is suggestive of osteosarcoma. Suggestive of osteosarcoma. So, will this be a breaking bad news or not? We have one said no. Another one said, Dr. Musarat said yes. Dr. iPhone said no. The X-ray is suggestive of osteosarcoma. Suggestive. It's not confirmed yet that it is cancer. So it is not a breaking bad news. It's a kind of telling the news in a sensitive way. In a sensitive way. All right? You can't tell the patient we have bad news. The X-ray is showing osteosarcoma or cancer without confirming. It is not confirmed yet. All right? Okay. So this was the last example for us. I think after discussion of these examples, you able now to recognize what is the breaking bad news and what is not the breaking bad news, right? All right. So this is in terms of recognition. Good, good, good. All right. Thank you, doctors. Let's talk about how to deal with any breaking bad news. Once you recognize that this case is a breaking bad news, you will follow the structure of breaking bad news. What is the structure of breaking bad news? As you can see, this is the main frame of breaking bad news. I'm going to say the main points briefly, then we are going to talk about each point in details. So once you enter the cubicle, you will look around. It's very important to look around you in any case, especially in breaking bad news. And we are going to talk about this, why you have to look around you. Then you give a frame to the consultation. and this is optional. You can use this point or you can skip it based on the time management. If you are a slowly speaker and you are not going to manage to finish everything within 8 minutes, you can skip this point. If you are a fast speaker and you can manage your time, then it would be better to use this point, okay? So look around, give a frame to the consultation, then gather your data, take some history, focused history, then break the bad news. After breaking the bad news, you will manage the case based on the context. Based on the context. You will do your management based on the case, the situation, and the context. Lastly, you will summarize the points that you have agreed on during the consultation. All right? These are the main points in the frame of breaking bad news. Why you need to look around? You might find a cup of water. You might find tissue. You might find a phone to call one of the family members. These are non-verbal clues, and it's very important to use them during the breaking bad news. All right? You can offer, maybe the patient will be crying, so you can offer a tissue to the patient. Offer. You don't need to give the tissue to the patient in the hand of the patient, but offer the patient some tissue. All right? You can tell the patient, do you want to take some sips of water during breaking the bad news? All right? You can also tell if you have phone in the cubicle, you can tell him, would you like me to call anybody of your family members to be with you in this difficult time? All right? So it's very important, as I mentioned, to look around you. All right. Give a frame to the consultation. It is very helpful in the cases of cancer test results, like ductal carcinoma in situ. You can give a frame before you talk about anything, after confirming the patient's identity and greeting the patient and introducing yourself. You can give a frame to the consultation. You can tell the patient, all right, Mrs. X, or all right, Mr. X. First of all, I will need to ask you a few questions about the presentation that you came with. Then I will ask some questions about your general health. After that, I will explain the results to you. And lastly, we can talk about the next step after explaining the test results. Would it be all right with you? All right? So this is about how to give a frame to the consultation. If you can't manage your time, skip this point. All right? Then gather your data or data gathering. The data gathering should be focused, to the point, relevant to the issue of the case. Relevant, relevant, relevant. If you attended the session of MLA, one of the criteria that is very important to any candidate to be able to do it is taking relevant history, being relevant. All right? How to be relevant? Let's take an example. Let's take the first example that we take in the start of the session. A 40-year-old patient presented with severe headache. The CT scan showed massive intracranial bleeding. They put him on the palliative care. All right? What are the main points in your data gathering or in your history taking that you need to take? What he already knows about the patient? Yes, this is very important question. What he already know? Severity of the pain. Why do you need to ask about the severity of the pain? That's why I wanted to be interactive with you. Why you need to ask about severity of the pain in this case? Dr. iPhone, history of use of anticoagulants, history of fall, past medical history of hypertension, medications like warfarin, trauma, Dr. Naveen and his idea, what is going on to happen? Yes, I do agree with Dr. Naveen. So there are two relevant questions here. Dr. Naveen, she said what he already knows about the patient and his idea, what is going on to happen. All right. To be honest, the other questions are not relevant to the issue of the case. That's why I asked you to write down or to speak about your ideas. What is the issue of this case? Is breaking the bad news. Breaking the bad news. If you ask about severity of the pain, will this be helpful in anything in the consultation? No. When you ask about the past medical history, will this be helpful in the case at all? In the issue of breaking bad news? The main purpose is to deliver the information in the best manner. Yes, good. All right. So what are the relevant questions in this particular case? Firstly, asking the relatives what do they know about the patient's condition. Then you can ask about the support around them. Is there anybody with them? You can ask also what happened exactly. Can you tell me briefly what happened? If you don't ask, how much do you know? All right. You can touch on the psychosocial part if the patient is elderly. All right. In this case, the patient is 40 years old, but if the patient is maybe 70 or 80, you can ask about some psychosocial questions like who does he live with, who is looking after him, to be able to touch on this in your management. Maybe they need some care package to the patient, all right? So touching on the psychosocial part will be appropriate in some cases, okay? After that, you can ask the relative is if there is anyone with them at the moment. These are the questions in the data gathering. All right? What are the irrelevant questions? The relevant questions are exploration of the symptom. If you explore the headache, since when? Was it go anywhere else? Asking about smoking and alcohol. Diet, exercise, smoking, and alcohol is not relevant at all. The past medical history as well is not that important in this case. All right? So always think about the issue. What is the issue of this case? Is breaking the bad news in appropriate manner. So you just ask the questions that will help you in delivering this bad news. All right? Also, it is not appropriate to start breaking the bad news once you enter the cubicle. So greet the patient, confirm the patient's identity, ask them about what happened exactly, how much do they know, and some psychosocial parts, and that's it. All right? So this is in terms of data gathering. Be focused. Be focused. All right? How to break the bad news? We are going to talk about it in a minute. In a minute. In the next slide. After breaking the bad news, you will talk about the management based on the case. In this case, is there anything is important in the management? I mean, any medical treatment? You will just need to explain the palliative care if the relatives don't know anything about the palliative care. then you answer their questions. So there is no need for any medical treatment in this case. In some cases, you will need to talk about medical treatment, like in ductal carcinoma in situ. You will tell her that we are going to refer you to the surgeon. The surgeon will discuss with you that treatment based on your preferences, like surgery, like radiotherapy, like chemotherapy, and these things. All right? So always think about the management after breaking the bad news. Then, if you have time, you summarize the main points that you agreed on during the consultation. If you have time, okay? All right. So let's talk about how to break the bad news. This is the structure of the breaking bad news. Firstly, you have to think about the ideas of the patients or the relatives, and we have talked about that. If you didn't ask the smart questions from the start, how much do they know? You can ask this question here. Do you have any idea about the situation now? Do you have any idea about the test results? All right? Why you need to know about the idea? To know if it's breaking bad news or not. And to know how are you going to break the bad news? In multiple pieces and chunks, or just one chunk is enough? If the patient already has an idea about the result, then you can break the bad news in one chunk or in one piece. All right? This is in terms of ideas. Then, offer the patient or the relative to come if it's phone or video consultation. Ask them, would you be happy to come and explain the results or explain the situation face to face instead of explaining it over the phone? Offer, just offer. All right? This is if the case is phone consultation or video consultation. All right? Then you ask the patient or the relative, is there anybody with you at the moment? Is there anybody with you at the moment? Why? Once you say this phrase, you are preparing this patient that there is a bad news is coming. The patient or the relative will recognize that there is something big is happening or something bad is going to happen. All right? So this is one of the shots that you can use. Anybody with you at the moment? Then you break the bad news in pieces and chunks. Usually, it will be like 2 or 3 pieces and chunks. All right? What are the pieces? Firstly, you tell the patient or the relative, unfortunately, I don't have a good news. Or, unfortunately, the news are not as we wish. Or, unfortunately, the news are not as you wish. Then a pause. Pause. Don't talk. Just look at the patient. Focus on the patient. There is one of the ways called Flanagan's. So we have many ways to break the bad news. Spikes, Flanagan's, what else? Something else. It's not on the top of my head now. But Flanagan's says something interesting. Shut up. Shut up. Sorry to say this, but shut up. Don't talk. Don't talk. Don't say anything. Just look at the patient. So give a pause for 1 or 2 seconds, then give the second shot. In the second shot, you tell the patient the news. You explain the situation. You tell the relative, in this example, you know that we have done CT scan, and the CT scan showed massive bleeding in the brain. Pause. All right? The last shot is the consequence. Once you deliver the bad news, you have to think about the consequence. Is it a hopeful case or a hopeless case? If it's a hopeful case, so you can give hope to the patient If it's a hopeless case, so you explain the situation and you tell them that there is no hope. All right? You tell the consequences. In this particular case, is it a hopeful or a hopeless case? It's a hopeless case. The patient is on palliative care, end of life care. So you explain that this is a hopeless case. How to explain it appropriately? You tell the relatives, unfortunately, the condition is critical and it's highly unlikely to survive that. And another pause. These pauses are for the relatives or the patients to absorb what's going on and to give them time to express their feelings. If you don't do that, the breaking bad news will not be appropriate. So this is how to break the bad news appropriately, in a proper way. 3 or 2 pieces, pauses in between, and then you should show genuine sympathy and empathy. Genuine sympathy and empathy. You have to show the patient that you appreciate their feeling. All right? Your tone of voice, your facial expressions, your body language should show that this is a bad news and you are appreciating what's going on. You can say, I'm really sorry to be the bearer of this bad news. It must be a difficult time. It must be shocking on you, Mrs. X. I'm really sorry for this. Then you can say to the patient, do you want me to proceed or call anybody for you? Some patients or some relatives don't want to know anything more about the condition. They just need to be with themselves. They don't want to know anything after that. So ask them, do you want me to proceed? Do you want me to call anybody to be with you at this difficult time? Then ask them, do you have any concerns before we proceed to the next point? All right, then they will raise their concerns, they will ask some questions, then you can answer their questions based on the context and the situation. So you ask about the ideas, offer them to come if it's phone or video consultation, ask anybody with you at the moment, break the bad news in pieces and chunks. 3 pieces if the relatives or the patients don't know anything about the situation. 1 or 2 pieces if the patients or relatives have an idea about the situation. Okay? In ductal carcinoma in situ, the patient might have an idea about the situation, or she has an idea that it might be cancer. So you can break it in one shot. You tell her you were concerned about cancer, and or one of the causes is cancer, and unfortunately the results showed that you have type of cancer. And pause. All right? You have to show the genuine sympathy and empathy, and then you ask them, do you want me to proceed? Do you want me to call anybody? Do you have any concerns before we proceed? Then you think about the management. All right? Do you remember this slide? We have talked about how to deliver the bad news. We are going to talk now about the essentials. What are the essentials that you have to have during the consultation or during the breaking bad news? Firstly, you have to have appropriate facial expression. Secondly, you have to have appropriate tone of voice. Lastly, you have to have appropriate body language. What does that mean? The facial expression means that you have the ability to play with your facial expressions, to show with your facial expressions that you appreciate their feelings. And I'm going to switch my camera on and I will show you how to break the bad news with appropriate facial expressions and appropriate tone of voice. All right? This is in terms of the facial expressions. In terms of the tone of voice, you have to avoid monotonicity and enthusiasm. It's inappropriate to tell the bad news while you're speaking up and you have enthusiasm in delivering the bad news. It's inappropriate to tell the patient or the relative, unfortunately, the results are not as we wish. The results show that you have cancer. Can you see the tone of the voice? Can you see I'm speaking up while I'm delivering the bad news. Your tone of voice should be lower than the patients or the relatives. The patients or the relative will be looking down, will be feeling down. The situation is very bad, so your tone of voice should be lower than the patients or the relatives. You say, Mrs. X, unfortunately, the results are not as we wish. And pause. Can you see the difference? Can you see the difference in the tone of voice? All right? So your tone of voice should be matching the situation. Should be matching the situation. This situation is very bad. The relatives or the patient might cry, might do anything shows that they not accept what is going on. They might feel down. So it's inappropriate to be enthusiastic or monotonous in delivering the bad news. All right? This is in terms of the tone of voice. In terms of the body language, it's inappropriate to deliver the bad news while you are laying back on the chair or crossing your arms, all right, or crossing your legs. This is inappropriate posture. Okay, so you have to sit upright. Let me switch my camera on. So can you see me, doctors? Hopefully, yes. So it's inappropriate to just sit down like this and crossing your arms, and then you tell the patient, the news are not as we wish, Mrs. X. All right, this is not appropriate. Okay, you have to sit upright and you have to lean a little bit forwards. Okay, and your posture should show that you are approaching the patient, you are approachable, you are a little bit closer to the patient. They will feel safe. They will feel that you are approachable. They will feel that, yes, you're appreciating what's going on and you are a nice doctor. All right? So this is the appropriate body language. All right? Okay, so let's say the breaking bad news by my way. In this particular example, we have taken what? The severe headache with massive bleeding, all right? So what I'm going to do now is just delivering the bad news while I'm hovering over the points that are important in the structure, okay? Just let me, what happens? Yeah, just a second. Yeah. Can you see this? All right, good. Okay, let's start. All right, good. So, let's say that the patient or the relative's name is Maria, okay? Maria. And the patient is Adam. He's admitted with massive bleeding in the brain, all right? If I didn't ask from the start, how much do you know about the condition? I can ask here, all right? So, Maria, do you have any idea about what might be the situation now, or what might be the CT scan result? Can you see the facial expressions? Look at my facial expressions, all right? Play with your facial expression and your tone of voice. Okay? All right. So, Maria, do you have any idea about what might be the results of the CT scan? If it's phone, would you be happy to come and to explain the results face to face instead of explaining them over the phone? Let's take the example of face-to-face consultation. So it's face-to-face consultation, right? Maria, is there anybody with you at the moment? Unfortunately, the news are not as we wish. We have done the CT scan, and the CT scan showed massive bleeding in the brain. Unfortunately, the condition is very critical, and it's highly unlikely to survive that. I can see, Maria, I can see how it is shocking for you. It must be a difficult time. I'm really sorry to be the bearer of this bad news. Do you want me to proceed, Maria? Do you want me to call anybody in your family to be with you in this difficult time? Before we proceed to the next step, do you have any concerns at all? All right? Can you see the facial expressions, the tone of voice? I'm not enthusiastic. I'm not monotonous. I'm dealing with the situation in a proper way. Do you agree on this, doctors? Do you agree on this? You can give me your comments. If you're not convinced that I didn't break the bad news in a proper way, please do share your opinion. Many of you said yes, it is appropriate. Okay. All right. Perfect. Thank you. Thank you, Dr. Iman. Thank you. Yes, slow down. Slow down. This is not a a usual information to say to the patient. You are saying to the patient or the relative that her husband or his son, his mom or her dad is dying. You have to slow down a bit. Yeah. Think about the situation. God forbid if you are in their situation. Do you think if the doctor is telling you your dad is dying and that's it, is proper? Are you going to appreciate this doctor? No. All right? Slow down, and your tone of voice should be lower than normal. Your facial expression should be matching the bad news. All right? Okay. All right, so what will happen now is that I'm going to share a question, and I need 3 or 4 of you to deliver the bad news based on this context, based on the question that we are going to read. All right? And after that, I'm going to compare between the performance, or not the performance, the way of breaking bad news between the 4 doctors in terms of the facial expression, the tone of voice, the body language, and the structure of the breaking bad news. Make sure that you switch your camera on, and I'm going to switch my camera on as well to be able to comment on your body language, your facial expressions, and your tone of voice. All right? Is this a problem? All right, no worries. Who are you? You are FY2 in the A&E. Who is the patient? Mr. Adam Goodwin, age 78, has collapsed and brought to the hospital with loss of consciousness by an ambulance. The initial survey has been done. The CT scan has been done and shows a massive intracerebral bleeding due to ruptured perianeurysm. So this is the results of the CT. Massive intracerebral bleeding due to ruptured perianeurysm. Use the information appropriately. All right? Additional information. The neurology team has seen the patient and reviewed his CT scan. They decided that surgery cannot be done. He is now breathing independently. Patient is unconscious. All of these are information that you can use during the consultation based on the concern of the patient. All right? Your task. Please talk to his wife, Mrs. Maria Goodwin, explain the husband's condition and address her concerns. This is your task. Explain the condition and address her concerns. Patient is in terminal condition and only palliative care is possible. Patient's wife doesn't know about her husband's condition. So, by recognition, this is breaking bad news. Patient's wife doesn't know about her husband's condition. It is a breaking bad news. We have recognized that this is a breaking bad news structure. All right? So let's deliver the bad news. You can switch your camera on, Dr. Mistura.
Is it okay now?
Can see you. All right? What I'm going to do now is that we are going to just break the bad news. We don't need the whole station. We just need to practice on the breaking bad news. The next session, inshallah, will be mock session cases. All right?
Okay.
All right? Okay.
Okay.
Just a second. Give me just a second.
Okay.
Language. Facial expressions and tone of voice. Way. All right. Let's get started. Yeah. I am Maria.
Okay. Hello, I'm Dr. Mistura, one of the doctors in accident and emergency. Are you Mrs. Maria Goodwin?
Yes, doctor. I'm Maria Goodwin. Can you please tell me what's going on with my husband, please, doctor?
Oh, Mrs. Maria, I can see you are quite worried about your husband's condition. He was brought in earlier today to the hospital because he collapsed. Okay?
Yeah.
And the team have assessed him. They've carried a special scan out on him to check his brain. Mrs. Maria, do you have anybody around, a friend
Oh,
or a family that you want to be in while I talk to you?
please tell me what's going on, please. I'm really worried about him.
Mrs. Maria, I'm asking this because I'm afraid I do not have good news.
What do you mean, doctor?
So when a CT scan was done on his brain, Mrs. Maria, are you sure you don't want a family member or friend in here?
No, doctor. No, I don't want. No, please tell me what's going on.
Okay, so the CT scan showed that your husband has suffered a massive bleeding into his brain.
Oh my God.
Mrs. Maria, I'm sorry this is quite challenging and a trying moment for you. I'm sorry to be the bearer of this bad news, Maria.
Is he dying, doctor? Is he dying? Will he die? Please tell me, doctor.
Oh, Maria, I can see this is quite overwhelming for you and you are quite concerned. So the specialists have assessed him and they feel for now an active management may not be in his best interest, Maria.
What do you
So they suggested we should have a palliative care for him. Do you know what palliative care means, Maria?
know, doctor? What is that?
So it means that we won't be having any active management because ideally when things like this happen, he's supposed to be taken to theater and have the blood in his brain removed. But in his case, the specialist won't be doing that.
So are you going to leave him like this, doctor? Are you going
Oh,
to leave him die?
oh no, Maria, we are not going to leave him. I'm sorry that you are feeling this way. We are not going to leave him. As a matter of fact, we'll be doing a lot for him in the palliative care. We'll manage his pain accordingly. If there are any secretions, we'll take care of the secretions so that it doesn't choke on his secretions in his mouth. Okay? And we'll make sure we turn it to develop bed sores. Okay?
Okay.
We'll also be inviting the movement doctors to ensure that his joints and body is not stiff. They'll be helping him with movement. Okay, and if he has any, if he saw himself, we'll change him as fast as possible. We'll just be managing any symptoms it comes with. We won't be doing any active management. Is that okay with you, Maria? Maria, I can see this is quite a lot for you.
Yes, doctor. Actually, yes.
Oh, Maria, do you have any concern at this point?
Yes, doctor. Can you put him on a ventilator, please, doctor?
Oh, Maria, I can see you are so worried about your husband, but presently he's breathing independently. He can breathe by himself and there won't be need to put him on a ventilator for now.
Okay, doctor. All right.
Okay. Is there anything you want me to do for you at this point?
No, thank you, doctor. Thank
Do
you.
you want to call any friend or family member to support you at this moment?
No, thank you, doctor. Thank you. I'm okay.
Okay, please just stay around. If we have any update about his condition, we'll notify you as soon as possible. And please be rest assured that the team will support you all through this.
Okay. Thank you, doctor. Thank you.
Thank you for speaking with me, Maria.
Thank you, Dr. Mistura. Thank you so much. All right. I'm going to comment and compare your performance with the other doctors. But generally talking, you've done it well. Just some points that we can talk about, and everything will be fine. All right. Thank you so much. Well done. All right. So let's do then the breaking bad news with the next doctor. As far as I remember, Dr. Dr. iPhone, no, Dr. Yorvashi. All right, Dr. Yorvashi, you can start.
Just I have to break the bad news.
Yes.
Okay, right. Hello, Maria.
Hi, hello, doctor.
So I know that you are here for your husband.
Yeah.
Do you have any idea what's going on with him?
What I know, doctor, that he had severe headache, and then they have done CT scan on his brain, and we are waiting for the CT scan.
Mm-hmm. Yes, yeah, you're right, Maria. So you rightly said that we have done a CT scan of your husband, and before I update you about your husband's condition, do you want me to call anyone besides you?
No, doctor. No, I'm okay. Please tell me what's going on with him, please.
Yes. Maria, we have done the CT scan, as you are aware about that, and we have a specialist team of doctors who reviewed the CT scan, and a multidisciplinary team of doctors has decided that by after reviewing the CT scan, we have seen that there is a massive bleeding inside your husband's brain. We have found that massive bleeding.
Massive bleeding. Oh my
Yes,
God. Oh my God. So, what will happen, doctor? Is he okay?
I can see it came as a shock to you, but the team of doctors has decided that right now your husband is breathing independently, and but unfortunately, uh, the team of doctors has decided that we cannot proceed further in like we cannot do any surgery or anything to stop the bleeding.
Did you decide to do a surgery before, then you stopped to do it, doctor?
I'm sorry, I didn't came up rightly. What I wanted to say that we have found a massive bleeding inside his brain, and uh, uh, because to stop that bleeding, usually if the bleeding is small, then we can't proceed for the surgery. But as I said, there is a massive bleeding inside his brain, so we cannot provide him with further treatment.
So are you going to leave him like this, doctor? You're not
Uh,
told?
I'm sorry I gave you this impression, but we are definitely not going to leave him like that. We will give him the treatment with whatever complaints he has. Like we can provide him the medications to whatever complaints he will show. Like we will provide him with the uh, uh, if he has a temperature, we'll give him that medication. But to stop that bleeding, we cannot do any particular treatment.
Who did decide this, doctor?
Um, yeah, so Maria, there is a team of specialist team of doctors we had, and all the doctors sat together and they decided, because the bleeding is so much inside his brain, we cannot go give any particular specific treatment to stop that bleeding.
Oh my God. So just do something for him. Even put him on any ventilator. Give him some help, doctor.
I can see that you're really concerned about your husband, and it's obvious to behave like this. But your husband is breathing independently, so there's no point of putting him on ventilator, because usually the patient who don't breathe himself, we put them on the ventilator.
Okay, doctor. Can I see him?
Yes, definitely, Maria. I'll make arrangements for you to meet him. Definitely, I'll speak with my seniors also, and I'll make arrangements for you to meet your husband.
Okay, doctor. All right.
Do you want to know uh, that what further we will do in this case?
No, doctor, I'm okay with that. I'm fine with that, doctor. Thank you.
Right. If at any point you feel that you want to talk to any of us, please come to us. And if you want any kind of help, please speak to us. One of us will be happy to help you.
All right. Okay, doctor.
Yeah, I know that it's a hard time going on with you, but we are here to support you, Maria. Don't feel lonely in this time.
Thank you. Thank you, doctor.
Thank you, Maria. Thank you.
Thank you. All right. Thank you, Dr. Yurvashi. Thank you for
Thank
your
you, Nasrin.
participation. We are going to talk about your performance in just a while after
Yes.
finishing with the other doctors. Thank you. You can switch your camera off. Yeah.
Thank you.
Okay. So, hello, I'm Dr. Senaika, one of the FY2 doctors in the A&E.
Yeah. Hello.
And could I just confirm your name?
Yeah. I'm Maria, doctor. Can you please tell me what's going on with my husband? Please.
I
Is he okay, doctor?
I can see you're quite worried about your husband, and I'm here to deliver an important update about his condition. But before we go on, how would you like me to address you?
Maria. Maria is fine, doctor.
Okay, nice to meet you, Maria. So, sorry, should I start from the whole mock or?
No, break the bad news.
Bad news, okay. So, I have an important update about your husband's condition. So you talked about how he was unconscious and he came to the hospital and he was unconscious when he arrived. And so our medical team assessed him and we did a scan to check what was the cause of his unconsciousness.
Yeah.
Unfortunately, Maria, we do not have good news.
Oh my God. What's going on, doctor?
So, Maria, we did a CT scan to see the cause of his unconsciousness, and unfortunately, the CT scan did not have a good result that we expected.
Okay, what is the bad result, doctor? Can you tell me?
Yes, so Maria, I'm afraid to say that there has been a massive bleeding in your husband's brain.
Oh my God. Is he dying, doctor?
I'm so sorry to tell you this, Maria.
Oh my God. My husband is going to die.
So I offer you tissues and water.
So, what are you going to do for him, doctor?
So Maria, in these sort of situations, we offer palliative care because palliative care is a type of supportive care. It's what we can do for your husband. Have you heard about that?
No, doctor. What is this palliative care?
Okay, so I would go into detail about this, but before we go on, would you like someone to join you and support you during this difficult time?
It's okay, doctor. I can manage. Please.
Okay, I will talk about this, but if at any time this is a lot to take in and you would like me to stop, just let me know, okay?
Okay, doctor. Yeah.
So, in palliative care, what we do is we reduce the suffering of the patient and we control his symptoms. okay? And we also try to improve the remaining quality of life.
Is he suffering, doctor?
So he is unconscious, okay? So we're going to just make sure he's not in any difficulty in breathing or any pain that he's having. We're going to give him something for that.
Okay, all right. Okay, doctor. Can you do any surgery for treating him?
I can see where you're coming from, Maria. However, at this time, the brain specialists have decided that any intervention will not be in his best interests, as he is unlikely to make it.
Okay.
I'm so sorry to tell you all this.
It's okay, doctor. It's okay.
Is there anything else you'd like to know? Any questions that is running through your mind? Any support that you'd like to have?
Yeah, I want to see him. Is that okay?
So at the moment he is unconscious, and just to bear that in mind. However, I will speak with my seniors and see how we can arrange that for you. Okay?
All right. Okay. Okay, doctor.
So in the meantime, if you have any questions going through your mind, any support that you'd like to have, okay, I'm here. You can speak to any of the nurses as well. Any members of the medical team will be more than happy to help you. All right, so is there anyone you'd like us to inform? If you want us to help you with informing your family members, please feel free, don't hesitate to ask us, okay?
Yeah, thank you. Thank you, doctor. Thank you
Yeah.
so much.
Thank you.
Dr. Samick. Thank you so much. Thank you for your participation. All
Thank
right.
you.
All right. So let's do the next one. Thank you, Dr. Noura. Dr. Noura is saying, Dr. Sahar, really thanks for this unique style of teaching. I have never seen this. Thank you so much. Thank you so much. Thank you. Thank you. Thank you, darling. All right. Okay. You made my day, to be honest. All right. So let's do then the next one with whom? As far as I remember, Dr. iPhone. Dr. iPhone?
Yeah,
Dr.
Dr.
Samuel.
Samuel.
Yeah. Dr.
Yeah.
Samuel?
Can you see me?
Yes, I can see you. All right. So, Maria, Adam, severe bleeding in the brain, massive bleeding in the brain, and yeah, palliative care.
All right. Can I go ahead?
Yes, without smiling. All right. This is a breaking bad news. Yeah. Yeah, immerse yourself in the situation. Yeah.
All right. Good afternoon.
Hello.
My name is Dr. Samuel. I'm one of the junior doctors in the accident and emergency. Can I confirm your name, please?
Yes, I am Maria, doctor, and my husband's name is Adam. Please tell me, doctor, how is he doing? Is he okay, doctor?
All right, ma'am. I'm actually here to give you an important update concerning his care. Before I go ahead, could you just bring me up to speed with what you know so far about what happened to your husband?
Yeah, he had severe headache, and I called the ambulance. After that, he lost his consciousness, and then I got scared. I called the ambulance. The ambulance came here, and they brought him to the hospital. The hospital said to me that we are going to do a CT scan on his head, and I'm waiting for the results, doctor.
Oh, I'm sorry you had to go through that. I'm sure that must have been a very scary experience
Yeah,
for you.
it is very scary, doctor. It is very scary. He's my husband. He's my lovely husband. Please, doctor, tell me, is he doing well, doctor?
All right, I'm actually here to give you more information concerning that. I'm sorry once again. So we've gone through, he has actually been attended to. He has done the CT scan that you talked about, and I'm actually here with the updates concerning his results. But before I speak to you, do you have anyone that you might want to be with you at this time to provide some support?
No, doctor. No one is with me now, but I'm okay. I'm okay. Please tell me what's going on.
All right. Unfortunately, Mrs. Adam, I have bad news for you. Unfortunately, the CT scan came out and it showed that your husband suffered a massive bleed inside his brain.
It's a bleeding. Oh my God.
I'm sorry about that once again.
Will he die, doctor?
Oh, it's a massive bleed and unfortunately it's quite critical and it's very unlikely for him to survive this.
Oh my God.
I'm sorry once again about this, Mrs. Adam. I'm sorry, it's understandable how you are feeling. I'm sorry once again about this. I don't know. Do you want me to proceed?
Okay, doctor. Tell me what will happen now.
All right, Mrs. Adam. We've invited the neurosurgery team to take a look at him since it's a bleed in his brain, and they concluded that the bleeding is so massive and he would not benefit from any active care. They've suggested that he is being registered under the palliative team to be taken care of in the palliative care.
Palliative.
Yes, this is a unit where they just manage his symptoms, they reduce his sufferings and ensure a smooth transition from him.
Yeah. Okay. All right.
Yes, that is what that means. That is how we'll be managing from now.
Yeah.
Is that fine? Is that fine by you?
Yes, doctor. So why did that happen, doctor? Why did he have this massive bleeding in his brain?
It's possible from the information I'm gathering, it's possible that may have been from the fall. May have been sorry. It's suffered. It has a ruptured berry aneurysm.
Doctor?
Yes, this is actually a vessel in the brain that actually ruptured and then the blood spilled into his body. That's the reason for the fall.
Okay. All right. Okay, doctor.
All right, sorry about this once again. I just want to know if you have any concern that you might need to address at this point.
Nothing in my mind for now, doctor. Nothing in my mind.
All right, I also want you to know that we're available for you at any point in time where you might need us to come in to assist you with anything as regarding your care. Okay,
Okay, doctor. Thank you.
you're welcome.
Okay. Thank you, Dr. Samuel. Thank you. I was just struggling a bit to hear you. Maybe the microphone in your mobile is just has a problem. I'm not sure, but I was struggling to hear you. But yeah, I got it. No worries. All right. Let's start with Dr. Dr. Mistra. Dr. Mistra, can you tell me what is your comment on yourself, on your performance? From your point of view, your comment on your body language, was it appropriate?
I think it was.
Okay. Your facial expressions?
It was too.
Okay.
But I'm not sure of the tone.
Yeah, the tone of voice should be a little bit lower than this. Okay. Okay. The way you break the bad news, was it appropriate, do you think?
Yes, I think so.
All right. Yes. But the only thing that I can comment on is the consequences. Can you see this one? Just a second. Hopefully, yeah. Can you see
Yes.
the consequence?
Yes.
You told me about the palliative care, right?
Yes.
But your explanation of the palliative care was too much explanation for a patient, for a relative who received a bad news.
Okay.
Explanation of the palliative care should be more concise. Okay, you can tell the patient it's a holistic care for the critically ill patients.
Okay.
The treatment which is in the best interest of them to make them as comfortable as we can.
Okay. Okay.
Right? So
yes.
Just the small points, small bullets about the palliative care instead of explaining all of the points or the things that you're going to do in the palliative care. The situation is really bad. She is receiving an information that her husband is dying, and it's too much to take in. All right?
Okay.
When you explain the palliative care, just be concise to the point. Okay?
Okay. Thank you.
Yeah, this is the only thing that I would comment. So 2 things, if you just work on them, your tone of voice just be lower than this. Yeah. And again, please.
Okay, I got that. The tone.
The tone and the explanation of things when you explain the consequences or the treatment.
Okay.
This is the only thing.
All right. Thank you.
Darling, thank you. Okay, Dr. Yurbashi.
Hello, doctor. Yes.
Yeah, hello. Okay. So, what is your comment about your performance or your structure or using the breaking bad news?
So regarding the facial expressions and everything, I don't know because I cannot see my face. So I cannot comment on that. Regarding the tone, yeah, I tried to lower my tone. And regarding the breaking bad news, I think I forgot to tell the patient the word that unfortunately your husband is in terminal condition. I think to that point is important that I should have told that your husband is in terminal condition. That I forgot to tell. And other thing that I was not able to explain very well regarding the palliative care. What is it? And the one mistake also I did that I told the patient that the team of doctors was not able to perform the surgery. First, I need to explain it that this is the specific treatment which we do usually if the bleed is small. But I straight away that's why you asked me what they were trying to do the surgery before and now they are not doing. So without explaining it correctly, I jump it into the surgery point. So that was wrong.
So what I understand from you that you tell me that it's not appropriate to tell the surgery part at first.
Yes,
Is
yes,
what
yes,
you mean?
yes, yes.
Okay. So, what about your body language?
I don't know. I cannot see, so I don't know.
Okay. So, maybe you were, I'm not sure, but you know, I know that in the exam, you will be sitting in the chair, you will be leaning forwards a little bit, and you should be sitting upright to you know, to deliver the bad news in a proper way, all right? So, this is my comment on your body language, because I felt that you were leaning backwards and
Yeah, right. Yeah, yeah, you're right. Yeah, I was on the
okay.
bed. Yeah, you're right.
Yeah,
Yeah.
all right. So this is the in terms of your body language. In terms of the facial expression, your facial expressions are appropriate with the situation. Okay. The tone of voice is okay as well. No problem in your tone of voice. My concern is the way that you delivered the bad news. You gave me too much information. You told me we have done the CT scan, and the multidisciplinary team reviewed the CT scan, and the surgeon reviewed the CT scan. Too much information. Okay?
Right. Okay.
Be to the point. Tell the patient, we have done the CT scan, and unfortunately, it showed massive bleeding in the brain. Few points to the point. That's it.
Okay.
You don't need to explain too much things to this patient. Too much information in breaking bad news will make the breaking bad news inappropriate.
Right. Okay.
Right? So just few chunks, pieces to the point. That's it. Then, when you told me, this is the first thing, when you told me the news, you gave me too much information. When you talked about the consequences, you talked about the surgery first. Tell me first, is there hope or not? Is he going to die? Is his condition critical? Or I can feel some hope.
Yes, right.
Right? So tell me, unfortunately, his condition is critical, all right? And you can say the condition is not promising. You can say this if you would like, okay? But always be specific about you know, the prognostication of the case. What is the prognosis? Is it hopeful, hopeless? Then you can talk about the other points: surgery, ventilation, palliative care, anything else.
Yes, right.
Right?
Right. Yes.
So I was concerned about the way you have delivered the bad news. No concern about the facial expression, no concern about the tone of voice. You talked about, or you told me, is there anybody with you at the moment? You were sympathizing and empathizing. Also, you asked me about my concerns, but the way of delivering was concerning me.
Right. Yes.
Got it?
Yes. Got it. Got it.
All right. Okay, Dr. Irbashi. Thank you
Thank
so
you,
much.
doctor. Thank you for such a lovely feedback. Thank you, doctor.
Thank you. Thank you, Barbara. All right, Dr. Samalika.
Yes, doctor.
Yeah.
Thank you so much, Dr. Sahar.
Thanks, darling. So how did you feel, or what is your comment about your performance?
To be fair, I was really very nervous. But I wasn't sure if I gave the right answers to her questions. I think there was a few points, like when she asked, is he going to die? And I just said, I'm really sorry.
Yeah.
I wasn't sure if that was the right thing, but I was just trying to give her time to react as much as possible. So that was one thing. And also the other thing was towards the end, when I talked about palliative care,
Mhm.
initially I just wanted it to be short, but then there was a lot of points to say about palliative care, which I wanted the examiner to know, right? So so then I think that was where I was a bit confused about what to say.
Okay. Okay. All right. So I do agree with you in the part of the when I asked you, will he die?
Mhm.
Okay. Your answer was, needs some improvement. All right.
Okay.
So okay. In terms of your body language, I'm happy with your body language, your facial expressions as well, your tone of voice. Very good. Sympathy and empathy. You asked my concerns. All of that are very nice. The way of delivering the bad news was proper, to be honest. You gave me some pauses. You delivered the bad news in pieces and chunks. But what was I concerned about is that you told me I'm offering tissue and giving some sips of water. Don't assume. If you don't have it in the cubicle, don't assume that there is something you are using. All right? If you don't,
Okay.
if you don't have tissues, if you don't have water, if you don't have phone, don't mention them. Just
Okay.
give the pause. Just give the pause, and that's it. And
Okay.
genuine sympathy and empathy. All right?
Okay.
That's why I want people to make some mistakes. We learn from our mistakes. All right? Okay. When I told you, will he die, doctor, or is he dying? You can say to me, all right, I can see how you are worried about him. It must be shocking and worrying for you. Unfortunately, the condition is critical and his condition is, or he's unlikely to survive that.
Like it.
But we are doing our best to help him. All right?
Okay.
Instead of saying yes. Okay? So this
Mhm.
is the point. But in terms of explaining the palliative care, you didn't give me too much information, to be honest. I was okay. I I didn't see that it is not appropriate. All right?
Okay.
So this is the only thing that you just think about, your answers to the questions, and avoid assuming things. All right?
Okay.
But well done. Well
Thank
done.
you. Thank you so
Okay.
much, Dr. Sahar. I think just on that part of the why I replied, I'm sorry to say that. Like, I'm sorry because I thought initially she will just be in that state of shock. So I expected she would ask me maybe the second time, but maybe this is the the script that we read, and at that point I think as you said, it's better to just answer her question and
Yeah.
move on, isn't it?
Yes. And be
Okay.
natural.
Okay.
Be natural based on the situation. Don't follow script, because in the exam, the simulations answers or concerns will be a bit different from the scripts. Okay, just follow the structure that you have, but go with the flow of the station.
Absolutely.
All
Yeah.
right.
Yeah.
Okay.
Thank you so much, Dr. Sahar. I
Thanks.
really appreciate it. Thank you.
Thanks. All right, Dr. Samuel.
Hello.
Hi. What do you think?
Well, this is my first time presenting ever, and
Can
I
you just
felt,
speak up a little bit, Dr. Samuel, because I have difficulties to hear you properly, if you don't mind, please.
all right. So I was saying this was my first time presenting ever,
Oh,
and
wow, good. That's really
I
nice.
was quite nervous and anxious, and I think that might have affected my presentation.
But maybe this was inside yourself. You didn't look that you are nervous, to be honest. And Dr. Samalika as well. Maybe this is inside yourself. But I felt that you were confident.
Well, all right, thank you, Ma. And also,
Yeah,
I also thought maybe I wasn't as empathic. I didn't show empathy enough. I think those are the only two things that I felt were wrong.
I didn't get the point, the last point that you mentioned.
Okay, I felt I didn't show empathy enough. Maybe I wasn't so. I didn't show empathy.
You didn't show sympathy.
Yes, sympathy enough.
To be honest, you did.
Wow.
You did.
Surprising.
Yeah, the only thing that I can comment on is that you give me small pauses instead of proper pause. Okay? You were talking a lot in between the pauses. Okay? Give me the information. Give a proper pause for me to vent or to absorb and to show my expressions, and then talk. You can count 2, then you talk again. You can say the information and then pause for 2 seconds, count in your inside yourself, 1, 2, and then talk again. You can say, I'm really sorry after 2 seconds. All right? Instead of small pauses. Got me, Dr. Samuel?
Yes. Thank you. Thank you very
Right?
much.
Yeah. But other than this, you've done it good. You've done it really well. Nothing else I can comment about. Just your mic, maybe. I was just struggling in hearing you. This is the point. Okay. So I think we have finished the session for today. Thank you so much. Thank you for attending and listening. I hope that after that, you are going to be able to deal with any Breaking Bad news easily, right? Do you think that? Yes, good. All right. Okay. So yeah, bye-bye for now.